pituitary gland is a small endocrine gland located at the base of the brain inside a bony cavity called sella turcica. It is often called the master gland because it controls many hormones in the body. This table in front of you describes the position of the pituitary gland and the structures adjacent to it and the clinical importance of those nearby structures. The superior relation, just above the pituitary gland, lies a membrane called the diaphragma cella, and 5 to 10 millimeters above there is the optic chiasma. This optic chiasma is where the fibers from the optic nerves partially cross. These fibers will carry visual information from both eyes. The clinical significance of this is when there is supracellular extension of a pituitary adenoma. This can lead to a problem called bitemporal hemianopia. How does this happen? The pituitary adenoma is a benign tumor arising from the pituitary gland. If the tumor grows upwards, this we call a supracellular extension. This will lead to a compression on the optic chiasma. Because the crossing nasal retinal fibers are affected first in this position, the patient will lose the outer temporal peripheral visual fields in both eyes. Because these nasal retinal fibers are responsible for the vision that comes from the temporal or lateral fields of vision. So when there is an affection in these fibers or damage in these fibers, something compressing these fibers, the patient will lose vision in the outer fields or in the peripheral temporal fields of vision. This problem is called bitemporal hemianopia. The second row in the table discusses the lateral relations. On both sides there are something called cavernous sinus. And this cavernous sinus contains several important nerves and vessels. Those structures that are inside the cavernous sinus are the third and the fourth and the sixth cranial nerves, and also the maxillary branch of the fifth cranial nerve and the internal carotid artery. These structures affect the eye movements and the facial sensation and the blood supply to the brain. So if there is a paracellular spread of pituitary adenoma or if there is a pituitary apoplexy, this can lead to cranial nerve palsies. Row number 3, which discusses the anterior-inferior relation. It means that we are talking here about the front and below of the pituitary gland. In front and below the pituitary gland lies the sphenoid sinus. Specifically, the posterior wall of the sphenoid sinus is close to the pituitary gland. The clinical significance of this is we use this sinus as a route for transsphenoidal surgery. In this surgery, the surgeons reach the pituitary gland through the nose, then into the sphenoid sinus, then into the sella turcica. This avoids opening of the skull. So this route is very important because it is less invasive and there is lower brain injury risk and there is faster recovery, and so this route is the standard treatment for many pituitary tumors. Now we come to the histology of the pituitary gland. Pituitary cells are classified by staining into acidophils and basophils. Acidophils, those are the cells that stain with acidic dyes and give the color pink or red, and these include somatotrophs and lactatotrophs. As for the basophils, these are the cells that stain with basic dyes and give the color blue or purple, and these include corticotrophs, gonadotrophs, and thyrotrophs. Here in the table, it begins by discussing the corticotrophs. So the corticotrophs percentage is 15 to 20%, and its staining is basophilic, and its location is anteromedial. The corticotrophs are the cells that are responsible for producing the ACTH hormone, which will then go to the adrenal gland and stimulates it to produce the cortisol. The second type of cells is the gonadotrophs. Its percentage is 10 to 15%, and its staining is basophilic, and its location is spread throughout the gland. The function of the gonadotrophs is to produce FSH and LH. The third type of cells is the lactatotrophs. Its percentage is 10 to 25%, and its staining is acidophilic, and its location is randomly distributed. The lactatotrophs produce prolactin hormone. The fourth type of cells is the somatotrophs. Its percentage is 50%, and its staining is acidophilic, and its location is in the lateral part of the gland. The most important fact in this table is that the somatotrophs constitute about 50% of the anterior pituitary cell population. This is a very high yield exam point. The function of the somatotrophs is to secrete the growth hormone. The fifth type of cells is the thyrotrophs. Its percentage is less than 10%, and its staining is basophilic, and its location is in the anteromedial and anterolateral parts of the gland. The thyrotroph cells are responsible for secreting the TSH, which will then go to the thyroid gland and stimulates the thyroid gland to produce T4 and T3. So there are two funny mnemonics here. The cells that are acidophilic cells, we can know them by a mnemonic which says acid likes growth and milk. Acid stands for acidophilic cells, growth stands for the growth hormone which comes out from the somatotroph cells, and milk stands for prolactin which comes out from the lactotroph cells. As for the basophils, the mnemonic is P flat. P stands for basophilic cells, the F letter stands for FSH, the L letter stands for LH, the A letter stands for ACTH, and the T letter stands for TSH.